My name is Charles Nelson. I am the president of the American Board of Orthopedic Surgery, as well as chief of adult reconstruction, or what some people would say joint replacement surgery, here at Penn Medicine. The American Board of Orthopedic Surgeons is the group that board certifies all of the orthopedic surgeons in the United States. The charge of the board is to protect the public, to make certain that surgeons are practicing high-quality, ethical orthopedic care. In our specific division, we've been able to recruit some really outstanding individuals. We train 42 residents at any one period of time, and we take a serious responsibility in doing a good job of training those individuals. There are two invitation-only societies that I belong to. One is called the Hip Society and one is called the Knee Society. And these are thought leaders in hip surgery and knee surgery respectively. They're limited memberships, 100 active members for the Hip Society, 106 for the Knee Society in all of North America. And I'm proud to say that 4 members from each society are people who I've trained as residents. That's something that I really feel very proud of, that some of the people that we've trained are now leaders at other institutions around the world. The strength of the medical institution as a whole means that we're collaborating with excellent people in anesthesia, excellent people in medicine who are involved in clearing our patients and making certain that the risk factors are minimized as much as possible. When there's complications, having people who can intervene quickly, all those things come together with other groups that are involved in the care of the patient. And I think one of the things that makes Penn so special.